What is a bowel obstruction? First, let's start with a bit of anatomy. Your small intestine does most of the nutrient absorption, while your large intestine reabsorbs water, electrolytes, and compact stool. And your ability to pass stool is driven by the coordinated actions of these organs. There are two main types of blocks. Mechanical, which is a physical blockage, things like adhesions after surgery, hernias, or tumors. This causes pressure to build up proximal to the block, which causes dilation, rising intraluminal pressure, leading to risk of ischemia, necrosis, and perforation. Next is a functional block. This is where peristalsis just stops, commonly found post-operations due to systemic illness or necrosis. Now, what's the difference between a small bowel obstruction versus a large bowel obstruction? Small bowel obstructions have more severe, cramping, intermittent pain, with prominent nausea and vomiting. There will also be distension, high-pitched bowel sounds, and is often due to extrinsic causes, such as prior surgery, hernias, or Crohn's disease. By comparison, a large bowel obstruction is more gradual. There is more bloating and distension. Failure to pass flatus is key. Also, vomiting might be late. You may see rectal bleeding, and sometimes a palpable mass. A large bowel obstruction is 4 to 5 times less common than a small bowel obstruction, and is usually intramural/progressive. Now, how do you deal with bowel obstructions? It's important to get as much of a history as you can. Also look for signs like dehydration, tachycardia, orthostatic hypertension, reduced urine, and dry mucosa. It's also important that you palpate and auscultate the patient's abdomen. Opiates may be used for severe pain and antiemetics for the vomiting. This is usually a surgical emergency requiring urgent transport. Now, there is an even less common condition called ileus, which is where the intestines temporarily stop moving, preventing the forward passage of intestinal contents and leading to a buildup of gas and fluids. This can be caused by an operation, narcotics, or systemic illness. Some symptoms you might see are nausea, failure to pass stools, flatus, distension, decreased bowel sounds, and hypovolemic signs. However, the treatment is the same as large and small bowel obstructions.